Substance-related and addictive disorders, presented by Andrea and Emmy. So you may ask, what substances fall under these disorders? Substance use disorders include alcohol, inhalants, cannabis, opioids, sedative, hypnotic, or anxiolytics, stimulants, tobacco, and hallucinogens. For the purpose of this video, we will be focusing on alcohol and cannabis use disorders. So what does addiction look like? And now we begin our cautionary tale of addiction. I introduce you to Avery. Avery is a 25-year-old graduate student at Richmond Graduate University. Avery began drinking socially in his undergraduate years at parties and bars. Once in Richmond, Avery began drinking daily to deal with the stresses of graduate school and other responsibilities within his life. Avery's alcohol consumption became heavier and heavier, which resulted in frequent intoxication. Avery fits the diagnostic criteria in the DSM for alcohol intoxication. There are 4 categories, A, B, C, D. Category A, he was recently intoxicated from the ingestion of alcohol. Category B, Avery had significant and problematic behavior and psychological changes. Category C, he fit at least one or more of the following signs and symptoms: slurred speech and coordination, unsteady gait, nystagmus, impairment in attention or memory, and stupor or coma. And then lastly, category D, his signs and symptoms cannot be attributed to another medical condition. One night, Avery attends a party, gets quite intoxicated, and is introduced to cannabis for the first time. The next day, Avery has a horrible hangover and has to attend class. He swears that he is done with alcohol. Two days have passed since Avery quit drinking. He has now started to experience alcohol withdrawal. There are 4 categories in the DSM diagnostic criteria. Category A would be Avery stopped drinking or reduced his drinking. Category B, Avery has experienced insomnia, nausea or vomiting, and anxiety. Category C, his symptoms in Category B cause clinical and significant distress or impairment in social, occupational, and other important areas of functioning. So for Avery, his missing class and skipping other responsibilities would fit this category. And lastly, Category D, you can't attribute the signs and symptoms to another medical condition. It is also significant to note the prevalence rate for withdrawal syndrome among middle-class, highly functioning individuals with alcohol use disorder is 50%. Avery cannot cope with his withdrawal symptoms and begins drinking again. After a few days of binge drinking, Avery gives it up, he swears for the last time, and begins to go through withdrawal symptoms once again. So Avery turns to cannabis to deal with his withdrawal symptoms. Avery goes heavy on smoking because in his mind he needs it just to make it through this school semester, and once the semester is over, because he's not attending summer classes, he'll try to stop over his break. Avery experiences cannabis intoxication. According to the DSM, Avery meets the criteria for intoxication because of the following categories. He recently used. Category B, he has significant behavioral and psychological changes such as anxiety and euphoria. Category C, he experiences increased appetite and dry mouth, and the signs and symptoms are not attributed to another medical condition. The next day in class, Avery begins to experience strong urges and cravings for cannabis because he has not smoked in a few hours. Avery decided that he really didn't need cannabis that much after all, and since he had made it half a day at school without smoking, he decided to try to stretch it out and see how far he could go. Well, after 1 week, he began to experience cannabis withdrawal. According to the DSM, cannabis withdrawal diagnostic criteria are listed as the following. He must have been quit after a prolonged period of heavy use, usually daily or almost daily over a period of at least a few months. He must meet 3 or more of the following signs and symptoms: irritability, anger, or aggression, nervousness or anxiety, sleep difficulty, decreased appetite or weight loss, restlessness, depressed mood, at least one of the following physical symptoms causing significant discomfort, such as abdominal pain, shakiness or tremors, sweating, fever, chills, or headache. Category C, the signs or symptoms in Category B cause clinical significant distress or impairment. In Category D, the signs and symptoms are not attributed to another medical condition. The following week at Richmond, Avery is suspended for missing classes and incompletes on his schoolwork. Avery's suspension just confirmed that he was totally done with substance use. But wait, what about that stuff called spice? Spice is known as synthetic marijuana or fake weed. It is often sold and disguised as incense. It does have some natural plant materials in it, but also has chemicals that can cause death, or it has landed many people in the hospital. Avery decided to try spice, and the results were not good. Avery ended up in Moccasin Bend Mental Health Institute. Avery begins to get help at Moccasin Bend from his therapist. The first step in order for the therapist is to determine if Avery has alcohol use disorder or cannabis use disorder. The therapist uses the DSM to decide which of these, or if either, Avery has. Pattern of problematic use resulting in impairment or distress signaled by 2 of the following within 12 months. Avery drank more and longer than he intended. He tried unsuccessfully to quit and control his drinking. He spent much time to obtain, use, and recover from its effects. He had strong urges and cravings, and his drinking caused him to fail in fulfilling responsibilities. Use despite persistent interpersonal and social problems caused or exacerbated by alcohol use. Avery gave up social, occupational, or recreational activities. He drank in physically dangerous situations. He continued drinking despite knowing he had a persistent and recurring physical or psychological problem likely caused or exacerbated by alcohol. He experienced tolerance defined by either a need for more alcohol to become intoxicated or a diminished effect when he consumed the same amounts. He experienced withdrawal manifested by A, the characteristic withdrawal syndrome for alcohol, or B, alcohol is taken to relieve or avoid withdrawal signs. Avery's therapist was able to determine that he has alcohol use disorder. After further review of cannabis use disorder criteria, the therapist was not able to give that diagnosis to Avery because he could not determine if his cannabis use withdrawal symptoms was due to cannabis or complicated by his alcohol use. Our cautionary tale of addiction comes to a happy ending, with Avery successfully completing treatment and graduating with honors from Richmond. So what does addiction look like, you ask? Addiction knows no cultural, racial, educational, gender, or socioeconomic boundaries. It looks like you, and it looks like me.